Lung cancer is one of the most common types of cancer in the United States. It strikes both men and women, and while smoking is one of the biggest risk factors, people who have never smoked also can develop lung cancer. Lung cancer develops silently over many years. Although it can sometimes spread quickly, conventional treatments like surgery, radiation, and chemotherapy can help fight it. Now, anti-angiogenic treatments are bringing new hope to patients with lung cancer. Like all tumors, lung cancer cells need a blood supply to feed them, so that oxygen and nutrients can reach the cancerous cells. This blood supply, grown by the tumor through a process called angiogenesis, lets the tumors grow and spread. Controlling angiogenesis is critical for health. Because most of us have microscopic cancers in our bodies growing all the time, these tiny tumors lack a blood supply, so they can't develop into a dangerous cancer. However, over time, hidden cancer cells can begin to release special proteins called angiogenesis growth factors. One of these proteins is called vascular endothelial growth factor, or VEGF. VEGF acts as a natural fertilizer to grow blood vessels, and it does this by attaching to receptors on healthy blood vessel cells, causing them to sprout new vessels towards the cancer. This growth is called angiogenesis. As new blood vessel cells bring oxygen and nutrients to cancer cells, the tumor grows bigger and starts to become noticeable on X-ray. Physically, lung cancer patients feel tired and may have trouble breathing or cough up blood. As more blood vessels feed the tumor, some cancer cells can escape from the main tumor and get into the bloodstream and spread to other parts of the body. This process is called metastasis, and it also depends upon angiogenesis. Research over the past 40 years has shown that doctors can slow or even stop the growth of tumors by using a new type of cancer drug called an angiogenesis inhibitor. These prevent new blood vessels from feeding the tumor, essentially starving it of the nutrients it needs to survive. Most anti-angiogenic drugs work by targeting the growth factor, VEGF or other growth factors like PDGF or FGF. Special drugs, called monoclonal antibodies, bind directly to growth factors, preventing them from attaching to receptors and causing new blood vessel growth. Some anti-angiogenic drugs work a little differently. They're called tyrosine kinase inhibitors, or TKIs. These drugs pass through the cell membrane and essentially short-circuit the cell's chemical signals, preventing new blood vessels from forming. When used in combination with chemotherapy, angiogenesis inhibitors can enhance the effects of chemotherapy or radiation and help slow or even stop the spread of lung cancer. Talk with your doctors to learn how angiogenesis inhibitors can help fight lung cancer. And also visit www.scienceofcancers.org.